Welcome everyone to week number 2 of our Beehive client webinar series. My name is Joni Hardcastle and I'm part of the benefits team here at Beehive. And I'm excited to learn with all of you over the next several weeks. We appreciate you joining us via technology today. And I would like to acknowledge our other 2 Beehive team members on the line with us today, Alicia Mann and Brooke Wilson. They will be assisting us behind the scenes today. We will continue to have our weekly seminars every Wednesday through the month of September. And we are recording this presentation and will send a copy out to all of you that are joining us today. We hope that this content will add value to you and your business. These topics that we've chosen in a large part are based upon the feedback from those that attended our last year's conference, as well as the feedback that we've received from all of you since the pandemic hit in March. Now, we've placed everyone on mute, but please feel free to ask any questions in the questions field of your webinar screen. And we would love to just thank you again for joining us today. Our webinar is sponsored today by Select Health, and we'd love to give a great big thank you to them for all of their support and their partnership. And at this time, I would like to go ahead and introduce our 2 presenters, Dr. Ann Pendo and Dr. Travis Mickelson. Dr. Ann Pendo is the Senior Medical Director for the Experience of Caring for Intermountain Healthcare, with responsibility for patient experience and physician well-being, with a deep belief that we cannot provide safe, high-quality care to patients if we are not well cared for ourselves. Dr. Pendo practices internal medicine in Salt Lake City and recently completed a 3-year term on the Intermountain Healthcare Board of Trustees. Dr. Pendo earned her medical degree at the University of Southern California and completed her residency in internal medicine at Harbor UCLA Medical Center, where she served as the chief resident. So welcome, Dr. Pendo. And Dr. Travis Mickelson was born and raised in the mountains of northern Utah. He graduated from Weber State University with a BS in zoology, followed by an MS in biology from the University of Nevada. Dr. Mickelson then spent 5 years teaching high school biology at a ski academy in Northern California, followed by 3 years teaching at international schools in Southern India and Switzerland. During his final year in Switzerland, he decided he wanted to return to school and applied for medical school. He graduated from the University of Utah and went on to complete a residency program in psychiatry and a fellowship in child and adolescent psychiatry from the University of Utah. After completing his training, Dr. Mickelson joined the Department of Pediatrics facility and worked at Primary Children's Hospital. After 5 years at the Children's Hospital, he took a sabbatical and moved his family to Mexico for a year. At the end of the year in Mexico, he came back to Utah and started working for Intermountain Healthcare as a full-time mental health psychiatrist and assistant medical director of the mental health program. He continues to be very committed to growing the program throughout the state and participates in collaborative efforts to support the development of integrated mental health programs throughout the country. We'd now like to turn the time over to our 2 providers for their presentation, Dr. Pendo and Dr. Mickelson. Welcome.
Thanks so much. So for those of you who can see me, I am in the airport in Washington, D.C., flying back to Salt Lake not having any idea what our home looks like. We lost a few trees, big fence went down. So it's been quite a year. And I was reflecting on our time together today with all of you and with Travis. This has been a year of a lot of uncertainty and change. I was in Washington, or in Richmond, Virginia, to visit our firstborn grandson, and who was born in April, and that was a high point for me and my husband. But we had to delay our joy until September, and so I'm sharing this with you today because we're all faced with things being different, and we're not alone in that. So even the medical degree behind my name and access to many, many resources doesn't take away the fact that this has been a trying time. And in preparation for our time together today, we'll recognize that all of you are facing the same issues, both in your personal lives and in your work settings. And so hopefully today, Travis and I can share what we've learned over the past 5 months and give you some things that you can consider and maybe a few things you can implement. So let's go to the next slide, Travis. As Travis and I were preparing, this is a slide that we wanted to share with you because we believe these things deeply, and hopefully they will resonate some with you. And you heard the first part, we can't care for others unless we care for ourselves. I'm going to be getting on a plane shortly. I know the flight attendant will be telling me that I need to put my mask on first before I put it on a small person that I'm flying with. And this is the same thing during this time of uncertainty and the pandemic. When we think about our patients, we're consistently reminded that patient care is people care. And so whether you are working in a healthcare setting or not, the people that we work with are the core of our work. It's what makes us who we are. It creates those connections that are really important and sustain us when times are hard. Thus, our last point of teamwork leading to fulfillment really kind of brings it all together in a way that to me and to Travis is much more meaningful as I think about my home team and my work team. Feeling like I'm connected to both of those is really important to me and leads me to feel joy in the work that I'm doing each day. Let's go to the next slide. So we thought it would be good to talk a little bit today about the impact of stress from a physical and emotional point of view. Talk a little bit about how to take care of yourself and then how to take care of your team. And then at the end, we've got resources that we are happy for you to share with yourself and your family and your team. So go to the next slide, Travis. I'm going to turn this time over to you now to Travis, to talk a little bit and help us understand some of the impacts of stress that we can feel both emotionally and physically. Off to you, Travis. And Travis, you are muted.
Thank you, partner. It's always a pleasure working with Anne. She's a really good person, a good friend. And thank you for this opportunity. I want to talk a little bit about this is your brain on stress and the effect that stress has on all of us as humans. Well, these last 9 months, 2020 has really been a real doozy. And these are some of the highlights we've seen in the news. Just want to share some information from the latest survey I've been able to see was done just last month that suggested that 40% of us in the general population within the U.S. are endorsing symptoms of depression and anxiety. And that's 4 times what it would be pre-COVID. And, it's not just COVID. It's in the spring, it was the earthquake. And right now we're dealing with hurricane force winds and the power outages. And it just seems like 2020 is not letting up on us. So this is a really nice slide that I wanted to show some research that has looked at the effects of major disasters and pandemics, such as the COVID pandemic. There's been some research that looks at within a community how our emotional state is affected by these major events over time. And if you look at the y-axis, you see emotional highs and emotional lows, and on the x-axis you see the do I have my axes right? The green arrow you see over time. And here's one thing that I want to highlight that I really experienced this spring and early summer. As a community, we all came together. We were all part of doing what we need to do to protect ourselves, our families, and our community. And there was an element of, I felt it, and a lot of my colleagues and friends and family felt it too, where we were all in this together, and we were going to step up and do what's right and take care of each other, and we were going to make sure that we were taking care of ourselves and staying healthy. And when so many of us experienced kind of an emotional high. We call that the heroic phase, followed by a honeymoon phase where we were just, really doing well and had a good approach to this. And then the pandemic didn't necessarily change, and the COVID numbers didn't necessarily change, and our local restaurants didn't open back up. And 9 months later, we're still dealing with a lot of the same. And we see this big downslide of this disillusionment where it's like we're just tired and worn out for everything that 2020 is bringing us. And then we can see that over time, we can have in kind of this reconstruction phase where we start to get back to kind of where we were pre-COVID pandemic. So what this highlights for me is that the way that we respond as humans to tragedies and major situations like this, it depends. And we are going to experience both growth and positive emotional times, and we're going to also experience negative times. And it's going to depend on where we are. But there is such a thing as post-traumatic stress and post-traumatic growth. And how we come out of this pandemic as individuals and as a community, how we come out of this is really going to depend on the support and resources we had pre-COVID and during COVID and after. So if you were to look at this graphic here, that suggests how trauma or stress-related disorders develop over time, I like this graphic that shows we have two sides, and it's a kind of precariously balanced. And there are some things that we aren't able to control in terms of how trauma or stress affects us. Like, we can't always have control over the fact that we experience a trauma. But when we look at in terms of lack of support, those of us who don't have support, who have lost jobs, who are financially in distress, who have experienced previous traumatic events, are going to be more likely to have this trauma affect them in a negative way than those of us who might be more set up and supported pre-COVID. The other thing that's important for us to appreciate is when we experience traumatic events and stressful events, oftentimes our brains start to create negative thoughts that are not just negative and ineffective, but maybe not even rational, maybe not even based on reality. Yet, if we don't have the ability to identify and notice those thoughts can also have an impact on how stress affects us. Likewise, if we have the ability within our family or with our loved ones, the ability to support each other and feel like people will listen to us and care about what we say. And if we feel safe expressing big emotions like sadness or fear, that's going to make us feel more supported. But not all of us feel comfortable or feel like they have people around them that will validate their emotions. And so it's not just the trauma that can cause post-traumatic type issues, it's all of this other support and stuff that goes along with it. And so what we're going to be talking about today is how can we identify that area on the scale that is really contributing to our stress, and how can we strengthen the other side that might build our coping strategies and our resilience so that we can handle and make it through this stressful time. So I want to talk with you about some of the specific information that I've learned about how stress and trauma affect our brains as humans. Now, one of the things that's very clear is that each of us as individuals have a threshold. We have a threshold. We can take so much stress before we just feel like we've just lost it, like we're just melting down. We've got that threshold. So sometimes it's a matter of just things piling up. Other times it's just a specific experience. But when that experience or the environment, when it jeopardizes our physical sense of safety and our psychological sense of self, and when we no longer have those natural coping mechanisms to support ourselves, what happens is that triggers our fight or flight response. And our fight or flight response is ingrained in all of us. It's something that needs to be turned on in order to be protected, in order to save ourselves from threat. The other interesting thing about how our brain works is our brains are wired to constantly scan our environment for threats. And so you can imagine what would happen if we are feeling a little bit emotionally tired and psychologically worn out, that we might tend to misperceive certain things as being threatening. So this fight or flight response, again, is something that is very natural, and it can be very healthy. If we're that little zebra in the savannah, and when a lion jumps out, we want to make sure that we don't stop and think about running. We just want to start running. However, sometimes that fight or flight response can get in the way of how we think through and problem solve. And that's what I want to spend just a moment talking about. And like I mentioned, sometimes these psychological traumas can really push us to a place where we actually feel like we're not just functioning, but really flourishing. And that's that heroic phase that I mentioned earlier. Let's talk about the crisis brain, because although our crisis brain is very important for us, the big part of our crisis brain that's involved in our fight or flight response is called the amygdala. And it's deep down inside of our brain. And actually, if you look at other mammals and birds and reptiles, our amygdalas all look about the same, which suggests that our fight or flight response is also something that's deeply ingrained, not just in humans and mammals, but in most animals. One of the things that really separates us humans from other animals is this big forehead that we have, or in my case, much bigger than a forehead. But this is where our frontal lobe is housed. And our frontal lobe is that part of the brain that makes us want to stop and think about things, stop and analyze, stop and compare and contrast. It's our problem-solving brain. But we don't want our frontal lobe turned on or activated when we're in a state of fight or flight, because we don't want to pause. we need to react. And so the crisis brain is reactive because the frontal lobe has been turned off. Our amygdala is sending a huge signal to our body, to our adrenal glands, to shoot off a bunch of adrenaline to get our body ready to start running. So all of us who have experienced the fight or flight response, we know that we don't think clearly. We notice our heart racing. We notice we get a little bit sweaty or restless or tremulous. We notice that we start to breathe heavily. These are all things that are physiologically required to get our body prepared to run as fast as possible. So, but going back to our crisis brain, of course, us humans, we're not necessarily worried about lions, those kind of threats, but we're still dealing with this frequent stressful situation that's been going on for months. And many of us have noticed that we've even seemed to be in this state of fight or flight more often than we should. And so that crisis brain is distracted, it's impulsive, it's emotional, it's forgetful, it's error prone, much like a young child's brain seem to be more often. But so what we need to appreciate is if we can appreciate that this is how our brain's wired to function during states of trauma or stress or crises, then I think you're going to appreciate and maybe even value more some of the specific recommendations that Anne's going to give you and how we can help manage this. And again, like I mentioned, when we're in our crisis brain, we don't think very well because our frontal lobe's turned off. And so when we're under pressure, we can become more prone to that tunnel vision. And if you look at this graphic here, it's a cylinder, but depending on what your perception is, you might see a circle or you might see a square. And the reality is it's neither, it's a cylinder. But this just highlights the fact that sometimes when we're in that crisis state, that we can sometimes make errors. And I'm not sure how many of you have heard of the term apophenia. This might be a new word for the day. Apophenia is a term that is where we tend to come up with patterns that aren't actually there. So we tend to make meaning in patterns that aren't actually rational patterns. And so anxiety can drive that, can make us make predictions or assumptions that aren't accurate. That's called apophenia. So I'm going to pass back off to Anne, who's going to talk about some specific things we can do to take care of ourselves.
Great. Thanks, Travis. So as we think about that taking care of you is critically important, we're going to share with you things that you might find useful as you go on about your day and recognize that you are leading teams of people. And this is one way that you can prepare yourself for being the leader of those teams or being a member of your family team at home. So go to the next slide. So this is one of my favorite slides that I like to use, and I will tell you all that I've been using this quite frequently, recognizing that the only thing I have control of is that little center circle of direct control. And it's what I think, feel, do, and say. That outer blue circle is a circle of concern. And I would say in 2020, that blue section is much larger than it appears on this screen. And those are things that I don't have control of. I don't have control of the weather. I don't have control of a virus. I don't have control of what my children do or what my husband thinks or what the Utah Jazz do. And then there's that center, around that center circle is the circle of influence. And that is where I have influence but not control. And I've spent quite a bit of time in these last 5 months thinking about whenever I'm feeling that my level of worry is increasing, I kind of bring myself back to thinking about what do I have control of? And then I focus on that. What don't I have control of? And I put that away. Sometimes writing it down is really useful. So focusing on what is in your control has been a really useful tool that we at Intermountain have shared with our teams to remind them that there are things that they do have control over, which then gives them some sense of there are things that I can do. Go to the next slide, Travis. And I think, actually, this is your section about prioritizing your goals and identifying them. And then we'll move on to some peer support in a minute.
Okay, sounds good. So, again, thinking about how stress affects our brain in terms of turning on that fight or flight response. And when our fight or flight response is turned on, we don't tend to problem solve very well, and we tend to get overwhelmed more easily, again, because anxiety drives that. Then one of the main strategies that we can focus on is really identifying and prioritizing the goals. So regardless of what tip sheet you'll look at, if you look at tips for managing anxiety, tips for helping your child manage going back to school, tips for this, tips for that, they'll always talk about maintaining a sense of structure and consistency and organizing your time. And again, it would make sense that if you're able to take a big list of things you have to do and prioritize them into just the top few things, maybe even the number one thing that has the most meaning or is the most important to do that day, that could help you feel from that overwhelmed sense or fight or flight response to a calmer, more organized approach to thinking. We're trying to acknowledge that the fight or flight response affects our brains and find ways of getting around that, ways of managing that so that we don't have the same negative effect.
Thanks, Travis. So just as you think about the circles of control and prioritizing, I want us to think a little bit about self-care and what it means to take care of yourself. And remind yourself that no one is going to do this for you. No one will do it for you. So if you should be taking a vacation, that's up to you to do it. Also, we each have our own unique way of taking care of ourselves. So what's effective for one person may be really the opposite for another. So recognizing that it's unique to each of us. It does require a clear commitment, and there will always be obstacles. And these days, the obstacles may be many. You may be working longer hours. You may be doing homeschool. There's always something that's going to get in the way. And so one of our former colleagues, Terry Flint, reminded us that taking 3 steps of self-care may be just the ticket. So rather than saying, I'm going to exercise every day, it may be, I'm going to take 5 minutes and I'm going to walk around the block as a way of leaving my work and transitioning to home. Go to the next slide. So really thinking about the coping skill that works for you. Here's some things for you to think about. Eating and drinking, healthy choices, exercising, doing deep breathing, positive activities, using positive reinforcers and rewards. Travis can talk a little bit about mindfulness practice, and he mentioned maintaining that a normal schedule for you as best as you can. My youngest child, who's an adult who works at Intermountain, her trick for this is, even though she's spending her days working from home and on Zoom calls, she gets up at her usual time, gets dressed, and prepares herself for the day just as if she were going to the office. And that's been her skill that has worked well for her. I think the next slide, Travis, is a little bit about mindfulness. So I'm going to turn back over to you. Oh, no. This is a graphic that was created by one of our colleagues, Dr. Marissa Hann, who is just earned her PhD from Harvard. She created it with one of her colleagues. And The graphics are fun and can be printed, and a nice way of reminding ourselves what we can do for emotional and mental well-being during COVID-19. So if you would like to have these graphics, we're happy to send them to you. So they've got the things that you can do, and then on the next slide, a few reminders. And I think this is really useful. It's been useful for me to remind myself and then to remind others that just kind of a way of framing things that has been particularly useful for us at Intermountain, reminding ourselves that this is a really strange and unprecedented time, and having a sense of humor does help. Go to the next slide. There we go.
Okay.
There's your mindfulness.
Okay, thank you. So talking about mindfulness, just again, I want to go back to one of the reasons why mindfulness is so important for us right now. Again, chronic stress puts our brains in this place of a chronic fight or flight response. And that fight or flight response can affect not just how we think, but also how our body works, our heart rate, our breathing rate. And that stress makes our brains, the brains do not like uncertainty. We don't like that sense of uncertainty. And so sometimes we'll make general statements. Our brains will think that because one thing in our life is uncertain, everything is uncertain. We overgeneralize. And one of the important things that we'd like to leave you with today is, even though much of our life, going back to Anne's circle of control, is out of our control, we do all know how to best cope with stress. As a parent, I know best how my child manages stress. And so we sometimes have to consciously remind ourselves that although we're living in a time of uncertainty, there is much certainty around. Even though we're living in a life with a lot of distress, there's a lot of love and beauty in this world. And Anne was so amazingly reminded of beauty with that little grandchild of hers. But I want to talk about mindfulness, because it has just been such an important role for me and my family. So one of the best definitions of mindfulness I've heard of is by John Kabat-Zinn, who's a great author. Paying attention on purpose in the present moment, non-judgmentally, as if your life depended on it. That last section sounds a little bit dramatic, and I'll talk to you about why I think he says that. Our brains are so good at predicting the future, thinking about what might happen, or thinking about what has happened in the past, that many of us might go throughout our day not really remembering a lot of what happened in the moment, because our brains were always distracted either in the future or in the past. So paying attention on purpose in the present moment is not something that always comes easy to us, especially if we're just doing a job like driving a car or sometimes in work. Paying attention on purpose in the present moment. So let me just give you an example. As you're listening to me right now, I know that your mind has wandered. And as your mind wanders, if you were trying to be mindful in participating in this event, every time your mind wandered to what you have to do next hour, you would just non-judgmentally notice that it wandered, and then come right back to the focus of what your attention is on. Now, the reason why we say non-judgmentally is that when we're trying to focus, sometimes it's very frustrating, and we get very frustrated with ourselves that we're so distracted that we can't stop thinking about something. Just notice. Don't be so judgy about what you were distracted about. Just come back to what's going on in the present. And as if your life depended on it, I think is dramatic, because when it comes down to it, this life that we're living is only right here, right now. everything that hasn't happened, we have no influence or control over. Everything that has happened, we have no control over. It's already happened. So really, at times the joy and beauty of life is just really in these mindful moments. And one of the things that I love about mindfulness is it's different than meditation. We can listen to webinars mindfully. We can eat mindfully. We can take a plane ride mindfully. We can go on a walk mindfully. Everything we do, we can choose to do it mindfully. In fact, we can worry mindfully, or we can argue with our spouse mindfully, because there might be a time where that's what we need to be focused on. So I'm not saying that we can't stress or worry, but maybe we just find some specific times and try to do everything in life, try to do it mindfully. Now, this is just a step-by-step. If for those of you who have never tried to meditate before, this is a step-by-step process of how you would do it. And while you're reading that, I just would like to share a story, a personal story of mine. Back in the spring, one of the things that one of the services that was provided to us as healthcare providers is the app company called Headspace offered a free subscription to all healthcare providers. And I had known about Headspace before, but I had never used it. Headspace is a mindfulness meditation app. And so as part of my self-care strategy, I decided that I was going to schedule into my routine. Ending my day was just start out at just 10 minutes, but build up to 20 minutes of a guided mindfulness meditation that would help me unwind from the day and prepare for going to sleep. And so I started doing that, and it was quite annoying at first to my wife because I was using the speakers on my iPhone, but then I noticed that in a few days she was putting down her book and she was participating in this mindfulness activity. And then my 12-year-old son walked into our room to say goodnight to us and noticed that we were doing this. And so he asked if he could join us. And I think it might have been just a way to get out of going to bed, but he laid down with us on our bed. And so now we have this routine where the three of us squeeze onto our small queen size bed and we all go through this 20-minute mindfulness meditation exercise. My wife and my son fall fast asleep. I don't think they've ever made it through the entire 20 minutes. And so I have to wake my boy up and get him back over to his room. But it's been a great experience for us as a family. And there's a couple of things that I want to highlight, what this really meant for me as a dad is it's very important for me as a dad to let my children know that even me as their dad also experiences stress. And even me as a dad need to do things that can be helpful for me to help me stay calm and manage my stress well. So I thought it was a great opportunity for me to be a role model to show my children that it's okay to do things that are helpful and relaxing. It doesn't make me seem weak or make me seem like I'm less of a dad. So I think it gave me an opportunity to set a good role model for my children of here is how an adult manages stress. And if an adult can manage stress, if it's okay for my dad and mom to do this, then it should be okay for me to do this as well. So I would just like to share that experience with you. And if there's one thing I'd like to send home with you as a challenge, it would be to explore mindfulness meditation. It's just had an amazing effect on myself and my family. And if you haven't experienced that, I would really love for you to do that. Let me go back to one more thing about mindfulness meditation. And remember, our fight or flight response causes our heart rate to increase and our blood pressure to increase. And that really kind of signals that our body needs all of this adrenaline. However, during mindfulness meditation, deep breathing we actually have the control, the ability to slow down our breathing rate, slow down our heart rate, lower the level of adrenaline in our system, which then is going to go back and have an effect on how our brain works. And so our brain's not going to be as affected by that state of crisis, that state of stress. So mindfulness meditation has a direct physiological effect at challenging the fight or flight response. It's far more than just, it can be so calming and soothing mentally and emotionally. It has a real physiological effect. I'm going to pass it back off to you, Anne.
Great. Thanks, Travis. So in addition to taking care of yourself, we wanted to give you some things that you might be able to use as you take care of your team. Certainly the things that we've suggested for taking care of yourself could certainly be things that you share with your team as suggestions for what they might do. But as we think about reminding ourselves that it's important to have work friends and outside friends, feeling comfortable to just support an emotion and not really get into the details. When you've had a hard day, not sharing too much information with your team, as that can impact how they show up to work and get through their day. Checking in on each other. And then really reminding your teams to set limits for themselves for how much they either watch the news or think about things that they don't have control over. So one of the tools that we wanted to give to you, go to the next slide, is thinking about you as a leader. So, and you probably do all of these anyway, so I'm going to actually skip to the next slide. And thinking about using some simple techniques to care for your teams. And this requires you to be present so that you identify and recognize someone on your team who might need some additional support. Listening and be present, not trying to fix what you see, and really being present with the emotion. So it sounds like you are angry, it feels like you're worried. This is a way of allowing them to correct you if you've gotten the emotion wrong, and then offering to follow up in a week at the end of the day. So as we think about what that could look like, go to the next slide, Travis. Being able to recognize the need. So someone who is typically quiet, but who now speaks in an angry voice, someone who has never had trouble with either doing their daily work, now has trouble completing tasks in a correct manner, someone who looks like they are sad, and someone who has new onset of physical complaints that can't seem to find a source. I'm sharing this with you because it requires you to be paying attention to those around you and knowing your team. So knowing that Joe is typically quiet and Mary is really outgoing, and watching to see if there's a change in their behavior as a way of saying, I should check in with them. I recently did a call and shared that if someone shows up every day on a Zoom meeting in the same outfit, that might be something that the leader of that team would want to check on. And sure enough, on Saturday, I got a phone call from somebody who said, you were talking about me. And I was, of course, not aware of that, but that person wanted to talk about how they were doing. So sometimes just scanning the room, knowing your team, knowing that something's changed is going to be really important. Go to the next slide. So as we think about, for us, what are the things that we need to remind ourselves if we are checking in with someone? At the bottom, there's some helpful things to say, but really being with them, staying calm, if they don't speak and there's a pause, being comfortable with that, and really not trying to fix. I think that's the next slide, Travis. I think in our roles, certainly in healthcare, when a problem's presented to me by a patient, my automatic response is to try and fix it. Really, what your job to do here is try and put yourself in their shoes, show concern for them, let them have their feelings, look for things that might be red flags, like, I don't know, there's no value to going on, this is never going to end, I just have no joy in my life. Looking for those things that might be clues that it's more, there's more of a concern than you may be aware of. And then remember, you want to keep your boundaries in place, and I'm sure you are aware of that. Go to the next slide. So as we think about what this looks like, and as we talked about committing to follow up, checking in to see who they have to talk to. Who do you go to when you're having a hard time? Is that person available to you? What are you going to do to take care of yourself? And I'm going to check in with you. And I've shared this story, Travis has heard it, but I had the opportunity to be the recipient of this. And I will say that as the weekend came to an end, because that's when the person said they would be checking in on me, I got a little nervous, like, are they really going to call me? And when they did, it was with a sense of relief. And so, and really, as I reflect on it now, helped me feel like I mattered to them. And that was really critically important. So that commitment to follow up is important, even if you think you're bothering that individual. Go to the next slide. I recognize that we're running short on time. We wanted to make sure, and we'll go through this very quickly, but we want to share with you what support is available for you and your teams. Go to the next slide. And we'll just run through this relatively quickly. Thinking about things that don't help probably makes a lot of sense. But I want to point out that jumping to problem solving and judging yourself are things that we often turn to as a, I'm not strong enough, I'm not good enough. Really trying to not go down that road is important. Go to the next slide. And then here's just a list of things to think about as you're meeting with someone, recognizing that these might be some of the things that they share with you that would be potential warning signs. Go to the next slide. I wanted to make sure that you were aware of the Emotional Health Relief Hotline. Travis was instrumental in setting this up. It is for anyone in our community, and there is someone available 7 days a week, 10 a.m. to 10 p.m. You get a live person at the other end of the phone call, and they can either, if it's a crisis, refer you to a place where crises can be tended to. They can schedule in appointments if therapy is needed, and then also provide you resources, or whoever is calling, with resources that may be useful for them. So, for example, I'm homeschooling 3 children, 6, 8, and 10. What might I want that would be useful for me? Go to the next slide. We also wanted to include for you, if there is a crisis, these are important numbers for you to have available to you. And as a leader, it's important for you to know where to go when there is a crisis. So we put a list together for you so that you could have that easily accessible. Go to the next slide. So we wanted to end with these really cute baby feet. And I like ending with this slide because the baby feet make me particularly happy. And so we talked today about the influence and effect that stress can have on our well-being. And thanks, Travis, for explaining that so nicely. I think it always is useful to understand that there is somewhat of an explanation for why we're feeling and seeing the things that we do. The importance of engaging in healthy coping strategies that work for us, reminding ourselves to take care of ourselves because we are not going to be able to take care of others if we don't do that first. And then finally, knowing where resources are available when more help is needed. And our last thought for all of you today is that seeking help is a sign of strength and resilience, not a sign of weakness. So being able to say to your colleagues, I'm so glad you came and asked me about this. I'm really proud of you. That was really important, matters. With that, we're going to end our time together today. We've got a few minutes for questions if there are any. Otherwise, we're available to you by email, and the Beehive team will be able to find us if you are requiring any additional information. So thanks so much for letting us join you today. And happy, I don't even know what day of the week it is, Wednesday. Happy Wednesday.
We would just love to thank our two providers today, Dr. Pendo and Dr. Mickelson, for joining us and offering this very, very timely advice right now. I too just love those little baby feet, and I can't wait to start my mindfulness challenge. So we will make sure that this presentation, we do have a copy of it, and we'll be posting it so that those that joined us today can have access. And then if we do have any follow-up questions, we'll make sure to get those to you two doctors and get the results back for everybody else. Just as a quick reminder, this webinar is being recorded and a copy will be sent out shortly to everyone. And we hope to see everyone next Wednesday, same time, same place, for another discussion on compliance next week. So thanks to everyone for joining today. Have a wonderful day. And thanks again, providers, for being here for us today.
Yeah, happy. Bye-bye. Bye, Travis.
Bye.
You're welcome. Drive safely. Bye.